calibrated isn't just for clinical procedures, it also applies to the language that you use in your practice. So make sure that everyone on your team is calling procedures or services or using the same language, calling it the same thing. And remember that a lot of the terms that we use between each other on the team, they're code words in dentistry. Our patients do not understand them, and sometimes they can get confused when they hear you saying different code words for procedures. So instead of SRP, or scaling root planning, say you're going to perform a disinfection therapy, right? Or this is gum therapy. Instead of a deep cleaning, because sometimes patients get confused when they feel like, oh, I have 2 free cleanings with my insurance every year, and you're recommending a deep cleaning. Why is it not free, right? It's because you're doing a different procedure. So instead of deep cleaning, again, you can use gum therapy, gum infection therapy, disinfection therapy. Just come up with another word that makes sense to your patients that you will all use. Instead of minimizing things that you see, right? A little inflammation or there's a little bleeding here, just call it what it is, right? There's bleeding. Patients will be concerned, and we should be concerned when there's bleeding. Same thing, if there's a little inflammation, there's infection here. Patients understand that, and they understand that if there's an infection, then there's some treatment that's involved with this. A big one that we notice holds a lot of people back is saying, I found, right? So one of the questions we often get is, how do I get patients to own their disease? Well, the answer is that we have to stop owning it for them. So instead of saying, I found, it is you have, right? So I found a cavity around the crown on number 14. You have a cavity around this crown, underneath the crown in the upper left. So just call it what it is, use terms that your patient can understand, and make sure you're all saying the same thing.